Spina bifida is a congenital condition that occurs when the spine and spinal cord do not form properly during early fetal development. It is one of the most common neural tube defects and can lead to various physical and neurological disabilities depending on the severity and location of the defect. Here's an overview of spina bifida, including its types, causes, symptoms, diagnosis, treatment, and prevention. Types of spina bifida. Spina bifida can be categorized into several types, ranging from mild to severe. Spina bifida occulta. This is the mildest form, where one or more vertebrae are not completely closed. It often does not cause any symptoms and may go unnoticed unless detected on an X-ray or during imaging for other reasons. Meningocele. In this type, the protective covering of the spinal cord, the meninges, protrudes through a gap in the spine, forming a sac filled with fluid. The spinal cord itself remains in place, and while this can lead to some complications, it typically results in less severe symptoms than myeloma meningocele. Myeloma meningocele. This is the most severe and common form of spina bifida. The spinal cord and nerves are exposed through the opening in the spine, which can lead to significant disabilities. Myeloma meningocele typically occurs in the lower back lumbar region and is associated with more serious neurological impairments. Causes. The exact cause of spina bifida is not fully understood, but several factors are believed to contribute to its development. Genetic factors. The family history of spina bifida or other neural tube defects can increase the risk. Environmental factors. Certain environmental factors during pregnancy, such as maternal obesity, diabetes, or exposure to certain medications like anticonvulsants, may increase the risk. Nutritional deficiencies. The lack of folic acid vitamin B9 in a woman's diet before and during early pregnancy is a significant risk factor for spina bifida. Symptoms. Symptoms of spina bifida can vary greatly depending on the type and severity of the defect. Common symptoms may include spina bifida occulta, often asymptomatic, but in some cases, there may be a tuft of hair, a pigmented lesion, or a small hemangioma at the site of the defect. Meningocele and myeloma meningocele. Physical symptoms may include a visible sac on the back, weakness or paralysis in the legs more pronounced in myeloma meningocele, lack of sensation in the legs or feet, difficulty with bowel and bladder control, scoliosis, curvature of the spine, hip dislocation or other orthopedic issues. Neurological symptoms may include learning disabilities, hydrocephalus, accumulation of fluid in the brain, which often occurs with myeloma meningocele, Chiari malformation, the condition where brain tissue extends into the spinal canal. Diagnosis. Diagnosis of spina bifida can occur at various stages. Prenatal diagnosis. Ultrasound can detect abnormalities in the spine during routine scans. Maternal blood tests. Elevated levels of alpha-fetoprotein (AFP) in the mother's blood may indicate an increased risk of neural tube defects. Postnatal diagnosis. Physical examination. Upon birth, a healthcare provider will examine the infant for signs of spina bifida. Imaging studies, MRI or X-rays, may be conducted to assess the extent of the defect and its impact on the spinal cord. Treatment. Treatment for spina bifida varies depending on the type and severity of the condition. Surgery. Prenatal surgery. In some cases of myeloma meningocele, fetal surgery may be performed to repair the defect while the baby is still in the womb. This can reduce the risk of complications, including brain damage. Postnatal surgery. After birth, surgery is typically performed to close the defect and protect the spinal cord and nerves. Rehabilitation and therapy. Physical therapy, to improve mobility, strengthen muscles, and enhance overall function. Occupational therapy, to assist with daily living skills and independence. Assistive devices, braces, wheelchairs, or other devices may be necessary to aid mobility. Management of associated conditions. Regular monitoring and treatment for complications like hydrocephalus, scoliosis, and bowel and bladder issues. Prevention. While not all cases of spina bifida can be prevented, certain steps can significantly reduce the risk. Folic acid supplementation. Women planning to become pregnant or who are in the early stages of pregnancy are advised to take a daily supplement of folic acid at least 400 micrograms to help reduce the risk of neural tube defects. Healthy lifestyle choices. Maintaining a healthy weight, managing pre-existing medical conditions like diabetes and avoiding harmful substances like alcohol and certain medications during pregnancy. Conclusion. Spina bifida is a complex condition that requires a multidisciplinary approach for management and treatment. Early diagnosis and intervention can significantly improve outcomes and quality of life for individuals with spina bifida. Ongoing medical care, rehabilitation, and supportive services are crucial in helping affected individuals lead fulfilling lives. If you or someone you know is affected by spina bifida, consulting with a healthcare provider who specializes in this condition can provide valuable support and resources.